One thing I always try to do, like the first time I walk into the room and meet the family, is make sure that I really introduce myself and pay attention to the child. I think it's easy sometimes in the pediatric world to like just go straight to the parents, and sometimes I think it does sort of bring them into the process, so that's one thing that I always try to do. I remember when I was in kindergarten, they had made us, draw a picture of like, what are you going to be when you grow up? And I just drew scientist with like beakers and a white coat, actually. So when I started thinking about it a little more seriously, I volunteered at a children's hospital out in Utah, where I'm from. Once I decided on medicine, I sort of knew pretty clearly that like I wanted to work with kids and kind of just be in that environment. But I remember one of our kind of introductory lectures about the heart, the physiology of the heart, the physics of it, like the electricity and the pressures and all that stuff. I was just fascinated with cardiac physiology. Basically, I do procedures on the heart, anything other than open heart surgery. Some of the very common things that we do would be closing ASDs, or atrial septal defect. So when there's a hole between the two top chambers of the heart, we're able to basically go in and put devices that close that by going in the vessels instead of opening the chest. These days, we're able to do some kind of more advanced things, like actually replacing valves and things without a full open surgery. So that's sort of the new, I guess, one of the new frontiers that we're exploring, which is really interesting as well. There's an innocence with children, and a lot of the things that they have, and especially a lot of things that I treat, are just things that they were born with from the very beginning, and obviously not their fault that they have this problem with their heart. Even kids in the hospital, even kids who are sick, they still can just be fun and play and just be happy even when things are tough. Every once in a while you sort of step back and have those moments where I reflect on like, well, actually I really do have like a really rewarding and really cool career, and not everybody gets to do this, and it's a good reminder that it really is like a privilege and a great thing.